Well, thank you everybody so much for joining us on a Thursday evening. My name is Joanne Hayashi. I'm the president and co-founder of Breast Cancer Hawaii. We're a small nonprofit here locally, and we support patients and survivors, their families, by connecting them with resources and support. I was diagnosed with breast cancer when I was 33. This was 6 years ago. And I have a partner here today that's helping me plan and facilitate today's event. So Bree, if you'd like to give an introduction.
Sure. I'm Bree DeWitt. I'm a physical therapist at Queens. I work with usually breast and other oncology patients and pelvic floor as well. I'm a breast cancer survivor as well. I was diagnosed in April 2020 at age 30 with triple negative. And I luckily was referred right away to fertility with Dr. Fratarelli and received excellent care. So looking forward to working with you further, Dr. Fratarelli. But we're really excited to have you all here that are so knowledgeable in all of these aspects of family building after breast cancer. So looking forward to it.
Yeah, and we do know that family building, whether or not to have children, these are very personal and individualized decisions. So we're here today to just help reduce a little bit of the overwhelm because there's just so many options. By providing you with some basic information today, we're not going to be able to cover everything in detail. Today's intent is to kind of give you just a variety pack tasting sampler. And if you in your feedback today, or for those of you watching the recording, if you let us know if there are any specific topics that you would like us to do deep dives on, then we'd be happy to facilitate that at a later date. And we also want everybody to know that it's completely okay if, building a family or having children is ultimately not the path that you end up going down. Brie and I know a ton of survivors. I shouldn't say ton. That sounds like an over-exaggeration. We know many survivors that are thriving without children. And so we are not here to either encourage or discourage it. We just want to provide some information for those of you who would like additional information. So that's the intent. We have a whole lot of questions that people have sent in for those that could not attend live. And so we do want to go ahead and get the speaking portion started. We did give every speaker a 6-minute time limit. And so I hope everybody doesn't feel like they're rushed or anything. If there was anything that wasn't covered, we can always do that at the Q&A. We've saved a good 20 minutes for that at the end. And then, of course, if there are other questions, then we'd be happy to field those offline too. And like I said, we can always do a deep dive later. So, okay, Bree is going to introduce our first speaker.
Yeah, so our first speaker is Dr. Jami Fukui. She is a clinical translational researcher at UH Cancer Center and a breast oncologist at Hawaii Pacific Health. Thanks for joining us, Dr. Fukui.
Thank you. Thanks for having me. We have a lot to talk about in 6 minutes, so I'm going to just get right into it. It's whether or not pregnancy after breast cancer is something that people choose to do. It is safe, and I'm going to go into why. There are some concerns about delay in treatment, but we do think that that is okay in certain circumstances. And there is actually a clinical trial looking at this prospectively called the POSITIVE trial. So there's a large systemic review or meta-analysis which compiled about 6,000 records over 8 million women, 112,000 women with breast cancer, and about 7,000 pregnancies. And what they saw was that in general, breast cancer survivors were 60% less likely to have a subsequent pregnancy. What they also showed, though, in that large review was that no significant increased risk of congenital abnormalities or reproductive complications were seen, although they did see some minor ones, which were listed here with C-section, lower birth weight. But overall, they saw in this study that women actually do maybe slightly better. We call it the healthy mother effect. And that's accounting not only for the type of tumor, the treatment somebody received, the pregnancy outcomes, or BRCA status. So we do feel, based on this large retrospective data, that it is safe to be pregnant after breast cancer diagnosis. And I want to just mention there's a totally different entity called pregnancy breast cancer, or pregnancy-induced breast cancer, which is a little bit of a misnomer. It's very rare. It's about 1 out of 3,000 women who have breast cancer when they're pregnant. We can safely treat as well during the second trimester. And so there are options, but I just want to let you know that that's a little bit of a different entity. Questions come up whether or not a delay in treatment is safe. Is it okay? There was another large review that looked at people who delay starting anti-hormone treatment. We know anti-hormone treatment is important after surgery or after chemo or radiation, whatever type of treatment is recommended. It reduces the risk of metastatic disease and overall breast cancer recurrence by 40 to 50%. And there are many different kinds of anti-hormones. And in this study, retrospectively, it looked at over 390,000 women for 10 years. They were a little bit later stage, and it showed that only about 3% of people had to delay more than 12 months, which is good because we usually try to start this right away. But it did show with the 5-year follow-up that there wasn't any significant difference in early recurrence. However, this study is a little bit early. 5 years isn't the time point we want. We want to hear about decades later. So I would say take this with caution, but it is okay maybe to delay treatment. This is the positive trial. So this is the prospective trial that looks at women who want to get pregnant after breast cancer diagnosis. This is for early stage disease, 1, 2, and 3, hormone positive breast cancer, up to 42 years of age. They have to have at least completed a year and a half, so 18 months to 30 months of anti-hormone treatment, and then you get a break. So you get a 2-year break to try and get pregnant, deliver, and breastfeed. And what we know so far from the 5 years that it was open, and it was open here in Hawaii, as well as many other countries, 20 countries, about 518 women were on this study. We're still learning about it. The average age was 37. 75% of people never had a kid before. And about 50% of people used fertility preservation, which we'll hear about later. A majority of people, 93%, had early stage, with 66% without any lymph node involvement. And I just want to bring our attention to the very bottom, because this was a little bit of a diverse population. So more Asian women in this study were shown to never have had a pregnancy before, and this was 81%, also 86% no lymph node involvement, and about 56% of the Asian women had tamoxifen with ovarian suppression as their anti-hormone treatment, whereas the European women tended to have more chemo. I just wanted to briefly say that clinical trials are so important because 95% of trials are mainly Caucasian populations. So really having input from our diverse population is very, very important, and that includes Hawaii. So take-home messages, hopefully under my 6 minutes, pregnancy is safe. Maybe there's a good mother effect to it. So we do encourage, if this is something that you have as part of your family planning, definitely pursue that. It is safe to do so. Whether or not somebody starts treatment right away or does the 18 months and takes a break is a balance between your goals and overall a conversation with your doctor. And clinical trials are important. They benefit participants, society, and science. Thank you. Here are the references.
Thank you,
Yay,
Dr. Fukui. That was definitely under 6.
No, I was like, you were so speedy. That was great. So much good information. Thank you.